I have it sent, and it's there in case
Hey,
you need
welcome
it.
back to the Mountain
I've
Morning
almost
Show.
never
So
needed
pleased to
it.
have you with us this morning. I have with me Dr. Stephen Helms, a naturopathic medical doctor and primary care physician. Welcome to the show, doctor. It's so great to have you here this morning with us. And are you going skiing after this?
Not today.
Do you think you might? Yeah, I'm more of a Bluebird Day type skier girl, but we'll see. But we're getting more snow. Happy all around. But this morning we're talking about a really fascinating subject involving naturopathic medicine. So what exactly is a naturopathic medical doctor?
Sure. Most naturopathic medical doctors, naturopathic physicians, are primary care physicians. There's a couple of specialists. There are a few naturopathic cardiologists, naturopathic oncologists that work in hospitals, but most are primary care physicians. So you could have a naturopathic pediatrician, naturopathic gynecologist, naturopathic family care. I'm a naturopathic general practice, or GP.
So what is naturopathic medicine? You mentioned those who can be involved in it, what it includes.
Sure. So the hope in naturopathic medicine is they're always trying to stimulate the body so the body can heal itself. And that's the distinction that carries through naturopathic medical school. So allopathic medical school, osteopathic medical school, and naturopathic medical school all have the same training. So we have pre-med, then we have our 4 years of school, we have basic science, national boards, clinical boards, and the like. You know, I happen to do residencies in some more unique things, I think, where I did therapeutic fasting, energy medicine, and oncology is a little bit more traditional. But really the different physicians have similar training. It's just the focus for naturopathic medicine is really not always giving prescriptions. I mean, I'll write people's prescriptions if they need them. You know, I'll give people IVs, vaccines if they need them. But we're really trying to stimulate the body. But oftentimes I have to meet people where they are. And if someone's 7 years old and had pneumonia, I'm going to give them an antibiotic. We're not going to try to do other things, just because sometimes the body needs extra support that way, and it's not a failure. It's not as if we're not being holistic then. You know, we're just trying to do the best we can to help people.
So Dr. Helms, give me an example, I guess, of maybe a patient you've treated, or just a general example of what you kind of expect from a visit to you, and maybe what you would prescribe and how that treatment would work.
Right. I think the biggest difference that people would see is that most naturopathic physicians spend probably an hour with people on the first visit. So I'd probably spend about 50 minutes or so just having a conversation, trying to find out what your concerns were, the history of things, how things had gone on in your family. So if there was a family history that helped unite things, and then do the normal physical exam sort of things that you would think of in a doctor's office where you'd put the gown on and the like. And then we get a chance through a whole hour and a half to finally sit down and say, well, these are the things, let's look at this. You know, I'd order blood work perhaps, and we'd do, you know, other conventional things. But the big thing is getting a chance for the other person to feel comfortable, so that we can really come together to say, well, what's the plan? Okay, we have these immediate concerns, but also how do we address your wellness? How do we address things down the road so these problems don't have to occur again?
So along with that, who should come see you as a patient?
Well, there's a difference in opinion there, meaning everyone has their different concerns. A lot of people might just see me as a second opinion. You know, they've already seen their own primary care physician, they have their own specialist they've seen, but they want an alternative, let's say, perspective. So I get a lot of people coming in for second opinions, but at the same time, people come in just because they have a cold, they have their own concerns, and I'm more of their first contact.
So, and going along with that, how does the Affordable Care Act or Obamacare affect naturopathic physicians? Because I know it's a question that comes up with a lot of people with it being a recent issue, and one that we want to be more aware of.
Sure. Well, as a primary care physician, insurance companies are supposed to accept my credential and pay for everything. But because of how laws are different in different states, insurance can choose or to discriminate. And what the Obamacare, Affordable Care Act has in it right now is a non-discriminatory clause, which means that as a primary care physician or qualified healthcare professionals, would have to be covered by insurance, which would be benefit.
Great. All right, well, let's talk more specifically about cleansing and
Sure.
what is the difference between a cleanse and a diet, because this is one of those things that you have your patients do, or something that you promote in terms of your treatment. So what is the difference?
Right. In our society, a diet is usually losing weight. Everyone's just thinking about what's your diet. And when we're trying to lose weight, most of the time people are going to reduce calories. But also, while they're on reduced calories, they're also doing the same activity level, or even a heightened activity level, because now they're motivated. And this is fine. Losing weight is a great thing. For every pound we lose, we have a 1% decrease in all-cause mortality, right? So a lot of our health factors, or how our body adapts, are increased. Great thing.
Wow.
But unfortunately with diets, it's reduced calories, and we're exercising more, which puts stress on the body. What we want when we go through any sort of weight loss, cleanse, diet, is we want the body to be able to come out of it and not boomerang back to where it was. So as soon as we start to do reduced calories, we have our metabolism go down. It's kind of a safety valve to help slow things down. But mainly with a cleanse, what we're trying to do is we're really trying to strengthen the body. We're trying to help the recuperative capacity of the body. And in our Western society, the main concern is with salt, sugar, fat, and protein. We really have too much of these things. So if we reduce these things, the body can actually lose the weight and also have a chance to heal in such a way that afterwards we don't boomerang back. Almost 100% of people on diets losing weight revert. You know, it's just a tough thing.
That's so discouraging for those who don't know the proper ways to go about losing weight. And briefly describe for us some of these types of cleanses. There are so many cleanses out there. Some, I mean, would you consider the lemonade diet?
Oh, sure.
Oh, that
sure.
sounds terrible. What that involves is that, I would see that as an unhealthy cleanse, because your intake of calories is very small. Or is that considered a true cleanse?
Right. Well, what you're speaking of, some people call it master cleanse. Dr. Christopher came up with it 50 plus years ago. But it deals with maple sugar, cayenne pepper, lemon. And it's giving about 600 calories a day. So for me, to give people an example, 2,500 calories maybe a day, something like that. 600 calories isn't a lot of calories. It's enough to feed the nervous system. And what that means is it gets just enough, the brain is content. It has enough
that's
glucose.
Terrible. It's like enough to keep you aware of even what's going on, but
Right.
not enough to have the energy.
But it means that if you're going to be active, if you're going to go to work, your muscles are going to be used for fuel. And that's one of the concerns that can come up with it, is that you're taking such a low amount of calories that you really need to be at rest. It's a lot closer to fasting. The same thing would be true of juicing. Juicing as well, when you put fruits and vegetables through a blender, you get about the same number of calories, 600, 750, which again, you're just taking care of the nervous system, which means that if you really want to healthfully lose weight and have the body be able to repair and not be stressed, you have to relax and be at home and read books and watch TV and knit. You can't be doing physical activity or just going to be burning your muscle.
So describe for me some of those healthier cleanses that you have your patients use.
Well, first off, I'll say that it really depends upon how the person does the cleanse. That's the most important. So doing a master cleanse is perfect, fine. You just have to make sure that you're not really physically active during it, or you're going to set yourself up for the rebound. The big thing underneath all of this has to do with a reward system in the body and how the brain works. We're designed to survive. So we're designed to go for food that has the highest concentration of calories. Highest concentration of calories. That's why we don't want lettuce. That's why we want the more filling things with a lot of fat and a lot of sugar, right? And we're designed to maintain that. And this is what gets us on any cleanse that we're on, is we always have this little dopamine circuit. We want to get that dopamine hit from eating something that's really concentrated. And in any cleanse cleanse that we're on, it's going to take time to transition. It's going to take about a month to transition for the salt, for our neuroadaptation, to get used to a lower salt level. The same thing is true of fat. It's going to take a couple of months. So the big point with any cleanse is to be consistent with it, because it's going to take 3 to 6 months after it where our body is going to still question us every day and say, this weight, this new weight, we're not going to survive at this. It takes 6 months for the body to say, oh, I can survive at this new weight. That's why we tend to have a struggle with it. Yeah. But there's a lot of different kinds of cleanses, and we can get into that more.
Excellent. Yeah, and so along with that, what would someone want, or why would someone want to do a cleanse or a fast?
Right.
You mentioned weight loss, but other reasons?
Well, you know, genetic potential sounds really fancy. You know, we all want to do our best. But unfortunately, because we have so much salt, fat, sugar, and protein, the body can't do what it really needs to do. Unfortunately, in America, people tend to eat twice as much protein. We tend to have over 100 grams of protein every day. And the body can handle it. You know, most healthy people can handle it. But especially if we're more in a compromised position, we're on medication, we have different medical conditions, the body's going to have a harder time with that and decompensate. We want the body to be strong. And what a cleanse allows is to get rid of these excesses that we don't need so the body can be more efficient. And for someone who's ill, this is going to be the difference between them feeling okay and not.
So can someone do a cleanse at home just with their own knowledge? Why is it important to have support from someone like you?
Right. Anyone can do a cleanse. Certainly they could even do it on their own if they're healthy. But you get into issues when we have medications and what cleanse you're doing. If you're doing a very reduced calorie cleanse and you're on medications, the medications can get potentiated. So we need to be conscientious about that. Someone's healthy, no medical concerns at all, you know, doing any sort of cleanse isn't a big deal because there's enough buffer in the body. There's enough compensatory mechanisms to compensate. And this is where some of the problems come up with healthy people doing cleanses. They do it and they feel so motivated, they feel so different that they want everyone else to do it. But the reality is they were just healthy enough that they could absorb the shock of doing it, and it wasn't necessarily healthy for them necessarily to have done it. It was just a shock, and they noticed a lot of things happening, as opposed to the body having a chance to really rest and repair.
All right, and you are doing a really great event, Spring Cleanse 2013. Well, I guess it's not just an event; it's kind of an extended workshop or a bunch of events and workshops combined. So tell me about this and what it's all about and how it benefits the community.
Right. Well, hopefully Spring Cleanse 2013 will really help out a lot of different people. We've tried to coordinate it so that people could just come for a weekend. You know, we have a lot of different activities from cooking demos and nutrition talks and qigong and breathing exercises, mind-body things, so people can get an opportunity to explore things they wouldn't normally. Coupled with that, people can just come to free lectures if they want. We have a free lecture series, you know, during the week. And the other thing is if they really want to do a supervised cleanse, you know, they can do something for 4 weeks, up to 12 weeks if they'd like. You know, where they'd sit down, we'd have a chance to go over what their goals were, you know, get a chance to appreciate a bit more of their concerns, their case, and work with them on that towards their goals.
So I was just looking over this flyer that you have for this. I mean, repair, restore, renew, something that I think all of us could relate to or want to experience at one point or another in our life. You have so many options here, like you mentioned, workshops and things, and one that I'm particularly interested in is cooking demonstrations. So you actually teach people kitchen skills, nutrition discussions, because I guess my experience with it is that nutrition, it starts in your home. It's that choice in the foods that you make in your home. How important is that component right there?
What I've really come to appreciate is that a lot of people have a real hard time with cooking. You know, the idea of just chopping. So literally, we started just with the ideas of how to hold a knife, you know, safely, and, you know, and how to make sure you're going to work in such a way not to cut yourself, and, you know, how to use some of the machines to your benefit, you know, make it easy so the cleanup can be there, you know, these things that dissuade us from it. But eating better, getting the sugar and the fat, these things reduced in our lives has a lot to do with moving towards having more vegetables. So, you know, this entails a little bit more effort, a little bit more prep, but fortunately we can do this prep in such a way that we can then put it in the fridge and not have to do it all the time. But the cooking demos, really helpful. Just give people a little sense of, oh, you know,
I
if
can
we-
do this. It's like
Exactly.
enabling to
Exactly.
allow them to do it themselves after they leave these workshops. Well, Dr. Holmes, thank you so much.
My
Where do we
pleasure.
go to get more information if we're interested in the spring cleanse?
Website, gettingpeoplewell.com.
All right, very good. Thank you so
Thank you
much,
very
Doctor.
much.
Pleasure
Appreciate it.
having you here. I've
Thank
learned
you.
so much about cleanses, fasts, all those things that you should take into account and consider having a visit with Dr. Helms. We'll be right back after this quick break. We are giving away a ticket to Park City Mountain Resort. There's just a couple more days left in the season. That's right after the break. Don't go away.